What is the effect of a COVID infection on the heart, and how lasting are the effects of this vis-a-vis heart failure and recovery from this? It is especially pertinent because there is still a fair segment of the population that doesn't believe in vaccinating and doesn't mind getting the infection. Does it leave a significant deficit as far as the heart is concerned?
So I'll dive into this one, Anjali, because I did actually give a talk on this about the last time we were here on COVID and heart disease. So I'll just bring up the salient 5 or 6 points. First, COVID affects every organ. We know that. Second, besides affecting the lungs, it definitely affects the heart in a big way, directly onto the myocardial cells, which is basically the actual muscle cells, and then indirectly by causing inflammation around the heart as well. And then it also does influence and make heart failure worse in a lot of patients that already have coexisting disease. And then 4 and 5, it also can propagate in many patients who have the risk of developing cardiac arrhythmias. The arrhythmias get worse. And then lastly, their lifestyle changes that sort of get hurt as well because of the declining overall health from COVID, fatigue, and so on and so forth. So those are the 5 salient points in this. And it also increases blood clot formation, which is very serious. Deep vein blood clots, and then also superficial vein clots and clots within the heart.
This is even if you're vaccinated.
Yes, vaxxed or no vaxxed. I mean, the risk is still there, and that's why we have to be careful.
Absolutely. Thank you. Any closing comments, Anjali?
For the COVID thing, yes, like Sam has put it very eloquently in 5 points. One of the issues is that so initially in the first 2-3 months of COVID, the concern was that the cause of death was cardiorespiratory, and in the heart, they said there's myocarditis, there is an increased number of thrombosis, so there is a huge number of heart attacks, and then arrhythmias. But over time, because at that point, nobody knew what was going on. And, last year, there have been 120 or 150,000 articles on COVID. It's like my experience, my anecdote, it doesn't work that way. So initially, CDC came out that there is more death with myocarditis, increased thrombus and heart attacks, and ventricular arrhythmias. What has panned out is a few months into the COVID pandemic in 2020, American Heart Association and Jack actually came out and said, where have the acute heart attacks gone away? Because the actual ST elevation MI numbers actually came down. So if they are coming down on the one hand, or on the other hand, you're saying there is more thrombosis and more heart attacks, it doesn't match. So that data is there's 2 separate kinds of data sets over there. Time will tell us exactly what it is. But myocarditis is a real problem with viral infections, and mRNA will be found in them. I haven't seen too many studies about it. And I heard about studies in which people who had COVID, normal young people, and this is the really scary part, they didn't have bad COVID. These are athletes. And months later, they are coming with cardiomyopathies. So I'm actually screening a whole set of patients who had COVID. We're doing echocardiograms on them, and we are actually collecting data to see where it goes. So far, we've not found any cardiomyopathy 4 to 6 months to a year after COVID, but our cohort is very small, but it is a real fear.